All right. Hey, what's up, guys? We have Pamela Topjian here to talk about hypnotherapy and her time as a nurse. So, how's it going today, Pamela?
Hi, thanks for having me. Doing great.
Yeah, cool. So, can you tell us a little bit about yourself first?
Yeah, so as you mentioned, I'm Pamela Topjian, and I am a former nurse of 14 years, and I switched over to certified hypnotherapist in 2020.
Okay, and let's start with the nursing, I guess. You said in your post that it was like kind of like a soul sucking career, right?
Yeah, yeah.
So why is that?
Well, you never had the resources that you need. You never had the help that you need. You were always overstaffed. I mean, understaffed, you had to do so many different jobs at one time. Like usually a nurse in a nursing home would have a med cart and you'd have either, one hall or one unit, and you would have CNAs that work with you. Sometimes if you were lucky, you had a med tech. Um, but the way it was in reality, that's a perfect world. So in reality, you had a couple halls, maybe you had one CNA to help. So you would have anywhere from 20 to 40 patients on your shift. And a lot of times you worked 12 to 16-hour shifts. So, and this is before 2020. This is before the pandemic. It was really rough. And I was the charge nurse on an Alzheimer's unit for a few years. So I you're not able to leave your unit for breaks or anything. So it was really draining. And then I had went through a personal mental health breakdown. And after that, you could not even, you couldn't do that kind of work. I tried to, and I just couldn't. But you always, even before that, you always feel like you never did enough for your patients. You couldn't give them the care that you needed or the care that they needed. Um, so it just was definitely soul sucking. Yeah.
Yeah, for sure. I don't know if that was like the exact word you used
It is
on the
because I've used
post.
it
Yeah,
before. So yeah, I've
yeah,
used it
yeah,
before. So yeah, I said that.
yeah. I
Completely
mean,
soul sucking. Yeah. All your time,
yeah,
all your energy, mind, body, and soul, all your energy. Took everything out of
yeah,
you.
yeah. I feel you because I mean, even at my job, I feel the same way.
Yeah.
I'm an Amazon delivery driver, but I've worked for the Amazon warehouse in the past, and it's like
Yeah.
sometimes you just feel like the stuff that they're asking you to do, like you just can't do,
Right.
or at least in the period of time that you're supposed to get it
Oh,
done in, or
yeah.
at least I can't. And so it's like this is impossible and
Right.
also unsafe, which is like now they're
Right.
like targeting, they're really going after, they're really trying to be as safe as possible. And I do honestly give Amazon credit for that. I think they kind of have to, being such a big company, but
Yeah.
I've worked with other companies too that are just don't seem to care about safety at all. So I mean, at
Mm,
least they're trying to care or pretending to care.
right.
Yeah, but so yeah, I was kind of wondering if you quit during the pandemic. I was kind of wondering what your thoughts were on the pandemic, because I know there's a lot of people out there who
Yeah.
I don't really want to get, I don't know if you want to get too controversial, but there's a lot of people out there, even in the healthcare system, who
Yeah.
didn't want to get vaccinated or whatever else, and that was a big issue. I actually know my
Right.
sister was actually a physical therapist, and
Hmm.
she didn't want to get vaccinated. So
Yeah. Well,
even though you weren't in it, did you kind of know people who were in it, and how was
oh,
that for
yeah.
them?
I know a ton of people in healthcare, of course. And there is definitely a divide. I'll just put it out there. I don't mind saying I'm fully vaccinated. I was all for it. Everybody in healthcare, we've had to get flu shots every year. So I didn't see this as anything different. I saw it as like, almost like a different version kind of what the flu would be. And it didn't seem like it was that big of a deal to me. But I also believed, I didn't think that there was any kind of conspiracy as far as, all the, refrigeration trucks and all the extra, um, not having room for people in the ER and stuff like that. I believe that that was true. I don't subscribe to that being some sort of conspiracy theory. And I don't ever try to, I've probably never even said that out loud. I don't try to change anybody's mind or make anybody agree with me or think anything different than what they think. That's totally fine, but that's the way I felt about it. However, during the pandemic, I was in home health care, and there was a situation, I was in that I felt unsafe, and just not only the virus wise, but just otherwise too. And so I just was not at that point in my career, at the end of my career. So 2018, 19, 20, I was just not putting up with any more crap at all. Like, if I'm going to do this, it's got to be perfect. It's got to be good for me and not at all a toxic or unsafe situation. So I ended up quitting there. Actually, I didn't quit there. I did kind of quit there because I was in home health and it was a baby. We didn't have everything that we needed to take care of this baby's needs. They were trying to keep people out of the hospital as much as they could, but just to free up beds and rooms and stuff, and the staff. And so the patient in home health was at home and should have been in the hospital. And I knew it. And that was part of the reason I felt unsafe, because if something happens on my shift, it's going to be my problem. And I don't even have everything I need for this child. So that was part of it. But then when the child went into the hospital, they said to me, we'll keep you updated, blah, blah, blah. We'll try to get you another case until then. And I said, never mind. I didn't want to be in it anymore. And I was already taking classes for hypnotherapy, which I had started that in 2010, and continued nursing, and was never able to get that part off the ground, enough where I could quit nursing even in 2010. So, yeah.
Yeah. And I mean, I was like just talking with I don't know, I was just talking with my girlfriend about it, and it just seems like the whole healthcare industry in general just kind of sucks, because it's like I lost my job, and I have the same job now. I got a new job, and it's the same job, but it's with a different company through Amazon, because Amazon outsources their work essentially for the drivers. And so right now I don't even have healthcare. So if I was in a situation where, I had to go to the hospital or emergency room or whatever, I'm right now I'm pretty much just screwed, because it's like I'm just waiting to get the healthcare. If I want to pay for the healthcare, it's $500 a month, or I think that's what it is, right around
Crazy,
there.
yeah.
Which is nuts for somebody who's unemployed,
right?
And it's almost like these hospitals have kind of like somewhat of a monopoly, even though it's not a monopoly, because technically you can go to the other hospital. But it's like, if I'm sick, I have to go to the hospital,
right?
If I'm going to die, and they can just charge me $40,000 or whatever they want, and you can make a case that like that's reasonable. But what's not reasonable, in my opinion, is I go see a psychiatrist for like prescription medication, like antidepressants and stuff like that. And just to see the psychiatrist, it's $15, or no, sorry, it's $250 for 15 minutes, in which case
gosh.
it's a phone call that she asked me like 2 or 3 questions and doesn't seem to care. And that's it. And it's like, it just to get this prescription antidepressant drug.
It's just the questions that they need on their record, on their forms, to be able to give you the medication. Yeah.
Which isn't much. It's like 3 questions maybe that she'll ask me, and then she'll be, okay, you're good to go for another 3 months or whatever.
Oh my goodness. Yeah.
Yeah. So,
yeah. And there
I
was
totally feel you there, but yeah.
Yeah. There was a lot within my whole career that they tried to do that was unethical, that was illegal. And I'm actually writing a second book all about my nursing career. So, just like the good, the bad, and the ugly, blood, sweat, and tears, not just from the patients, but yeah, there was a lot of people that were stealing the medications. Then there were patients that were, declining or getting worse and acting out and stuff because they didn't have their medications, because another nurse would, sign out that they gave them to them, but then they didn't really. It's just, there's a lot of corruption within it. And it's just really sad. It's really sad. Yeah. And I had tried to work in nursing homes. I worked in a small hospital for a short time. I worked in detox and recovery. I worked in then home health with all different ages and stuff. So I kept trying to go to different forms of nursing to keep my license and to keep, it's a good job. You can get a nursing job anywhere you want to live, right? And there's so many different types of jobs for nursing that I wanted to keep on, keep with my license, but I was trying to find a good fit and trying to find a place that was doing everything right. And I just had such a hard time finding that. But I also
Yeah.
had, I have arthritis bad in my hands now, which I didn't have before. And when you are in a nursing home, they have these medication cards. They're they're like cardboard with lines and rows of medications and pills that you have to push out with your thumb. And when you've got between 20 and 40 patients for between, anywhere from 12 to 16-hour shifts, you're doing that so much, you don't even realize it. And it causes, degeneration in your joints and your thumbs. So just that alone, even, just really a soul sucking career for sure. Yeah.
Yeah. Yeah. Like I said before, I mean, I think there's a lot of soul sucking careers out there, and there's a lot of toxicity in the workplace, which like
Hmm.
should just not be there at all. It's kind of
Right.
like, I mean, there's I'm sure I'm not even a woman, but I'm sure there's tons of men who make women feel uncomfortable, like sexual harassment type stuff. That's why they have all the sexual harassment classes.
Yeah.
And I feel uncomfortable as a man, just being in certain environments. It's like, man, this is just horrible. Like,
Yeah.
and I just want to get out. And I think the goal is, like you were saying, to try and find, I guess, the perfect job for you, or not even job, but like the perfect specific job or location to
Right.
work at. But that's hard because you can't just be bouncing around from job to job. You know what I
Which I
mean? Like I
was
was
doing.
saying.
Yeah.
Yeah, because you're in the meantime, you don't have money, you don't have insurance. It's not fun. But I do talk, like I was talking just once again to my girlfriend today about it. It was her. So her friend is a nurse, and my sister is also a
Mm.
physical therapist.
Hmm.
And my mom was actually what do you call it? A psychiatric nurse. And I know
Oh.
that some people seem to like really like the
Hmm.
healthcare industry. I don't think that I would. I think that I would be
Yeah.
on the same lines as you, where I would just feel uncomfortable.
Yeah.
But and my girlfriend's friend was telling her friend, it's kind of confusing, but like my
Yeah.
my girlfriend's friend was telling their friend, she basically was she was saying how she only makes a certain amount of money and it's not enough. And she was just like, well, go get another job. And it's like, that sucks. Like, I don't want to have to work 80 hours a week just to survive, because that's how it is right now. You know what I mean?
Yeah.
It's like the company should just pay you enough money
Right.
so you can survive. That's all I'm asking to do, is just survive. But
Right.
in terms of it sounds like, my point with that was kind of like, it sounds like I know that she makes a good amount of money. So in
Hmm.
terms of the money is probably pretty good, right? As a nurse, or
Yeah. And that's why you want to try to keep with it. And that's why it's hard to change careers as a nurse, because first of all, you're working so much, you don't have time to look for another job. But also, the money is pretty good, and you don't want to leave that. So you try hard to hang on to that. It is a good salary and you worked hard for it, whether you're a registered nurse or a licensed nurse, you worked hard to get to that position.
yeah, for sure. And then, so where did you go to school, and where did you, if you don't mind me asking, like, where did you work at? Maybe like just like the location, the county or whatever.
I worked, so I moved a lot of states. I moved around a lot. So I got my nursing education in NMU, which is Northern Michigan University. I lived up in the UP for 15 years in Upper Peninsula. And, but I grew up in Illinois, but I moved up there with my first husband. So I went to NMU. And then from there, I was just going through a divorce at the same time I was graduating, and so I was able to work at this very small town, very old little hospital. And it was a good experience. I got to do a little bit of everything, and they allowed me to work and be training in my nursing position until I even got my um, until I got my results back from the state boards. So I did all that in Upper Michigan. And I had passed, obviously. So then I went on to full position for nursing there. And then I went to that. So that hospital was closing down, and I was the newest nurse, and they were opening up somewhere else bigger. And so they had a little period of time that they weren't, I wasn't getting all the hours that I needed. And I was on my own now at this point. So from there, I went to a nursing home. That was my first nursing home. And I got a lot of experience there. It was my first time seeing, have an investigation where employees were stealing medications and stuff, and there was just some shady stuff going on. And I got to see not having enough time to do what you needed for your patients, and wasting a lot of time running all over looking for what you needed. Um, I got to see what it's like in a nursing home for the first time there. And then from there, I moved to another state, more nursing home experience. And then I went to home health, um, and did a lot of different home health types of jobs. And then um, went to a plasma center. So that was kind of fun, but I don't know if you know anything about plasma centers, but there's a lot of like sort of like either like homeless or just on the edge of homeless. There's some alcoholics or addicts and that try to, because you can get like $50 or something every time you donate. So you have a lot of sort of these dangerous kind of street people that are in those places. But as a nurse, it was a pretty good job there. Um, and I moved again and had to go to another nursing home, and that's the one that I had worked at the longest. So I had done quite a bit in nursing. And then
Okay.
and then after that experience is when I had the mental breakdown that I was talking about, and moved again to California where I'm at now. And I took not quite a year, but I took some time off of nursing. I didn't really want to go back to nursing. And I was just doing like live-in, pet sitting, house sitting, even some residential live-in elder care, did some of that stuff before got my license back in California and went back to home health.
Yeah. And where in California are you now? If like you could say northern and southern
Yeah,
and
I'm in
central.
Northern California.
Okay.
Yep.
Okay. So I'm in southern.
Mhm.
But yeah. Um, yeah, I mean, I can only imagine how hard of a job it is. I mean, like I heard, I don't know if you know who like Bo Burnham is. He's like a younger kind of like YouTuber guy, like
Mhm.
comedian, like
No.
musician. I heard him on a podcast and he was saying like his mom worked with I'm forgetting what it's called, but like the people who are like about to die, they go
Oh, on hospice?
on hospice. His mom
Mhm.
worked with people on hospice, and he was
Yeah.
saying that, and I totally agree with them. Like that has to be one of the most difficult jobs, or
Mm.
really any nursing job, but especially that one where you're working with people who are just about to die every day. It
Yeah.
takes, a lot of men talk about how strong they are or whatever, but it's like try working with someone who's on death's door every day. I mean,
Yeah.
that's got to be extremely difficult. And I'm sure there are men who do it too, but I think in general, women are better with healthcare. I would imagine. You know what I mean? Like with
Well,
taking care of people.
we're more maternal naturally. You kind of have that maternal instinct, and that motherly kind of caregiver type of instinct, not to generalize. A lot of men have that too, but I think in general, for the most part, a lot of women do have more of that kind of giving nature and caring nature, and empathetic nature, a lot
Yeah,
more so than a lot of men.
yeah,
Yeah.
for sure. And then you had okay. So can you speak on the mental breakdown at all, or what
Yeah.
kind it was?
Yeah,
Yeah.
sure. So then after my first marriage, I got married again pretty quickly. And this man was an alcoholic, a prescription drug addict. And he became very violent and ended up, being violent towards me. And I ended up leaving him, by having to call the police. I got out of that marriage. So it was after that that I kind of had a total breakdown. Like you would think that, oh, good, you're safe, you're free, you're on your own, and everything's going to be great. But I also had some traumatic events in my childhood, which I never even considered were still inside of me. Um, and that's part of where hypnotherapy comes in, is, getting to the root of things rather than, just the surface things. So yeah, so I, had all this stuff come up. Once I had made it out of that situation, then I was, suicidal. I was highly anxious. I was just unable to almost even take care of myself. And I was living on my own, and I got on a bus to California with a one-way ticket from Missouri. I had a friend that was also very anxious and having a hard time, and said, a friend had suggested to him to do that because his friend lived in California. I didn't know anybody in California, but he had a friend that said, hey, come live with me for a little while. You can get back on your feet, get the care that you need, and start over. And so he said, hey, I might do this. Maybe this is something you want to do. And so I told my landlord about it. And they said, and I had a few months lease left. So I was really trying to just be communicative and tell them in case I was going to leave early. I said, I'm thinking of moving out of the state and I may need to break my lease, blah, blah, blah. And so then they said, can you be out in 2 weeks? And so I said, I'll try. And so they wanted to sell the house. So I did everything I needed to do. I moved across the country on a bus. And then that's how I ended up with those jobs for caretaking, and pet sitting and house sitting and that kind of thing. Because once you move from state to state with a nursing license, you have to go through a whole thing with the State Board of Nursing in each state to get your license in that new state. So it takes a while. And I didn't even want to do that. I knew I didn't even want to do that. So I was taking all these other jobs before I figured it out. I wasn't sure I was even going to stay in California, So, so yeah, so I, had all that happen and going on. And eventually I got some therapy, and I was able to get myself back to where I could try nursing again. And that's when I went into the detox and recovery, because I kind of felt like, I was, I also had another family member that had addiction problems. So I thought, this is kind of my way of giving back or trying to help the system a little bit, because the other people in my family and my ex-husband never got the help that they really needed. So I thought, maybe this will be my purpose in nursing, go into detox and recovery. So that's where I started that. But it took a couple of years to get myself kind of back from that mental break. And that's, and then when that wasn't working out, still again with nursing, and I found myself getting anxious and depressed again. It's like, I'm not going back there. I want to get back in that place in my head. So that's when it was getting right near 2020. And I said, you know what, I'm going to try this hypnotherapy thing again. I actually
Yeah.
had, yeah, so a way to get out. And I know it sounds kind of crazy, but I'm remarried again. And after therapy, it's completely different now. So um, actually in a truly loving and respectful relationship, which I never knew before. So all of that kind of all helped me to get to be able to do what I want to do and what I really feel more called to do than just going for one job after the other, trying to find a good fit in nursing.
Yeah. Yeah. I definitely feel like being in a good, healthy relationship or marriage is a good thing to be, um, stable or whatever, like not
Yeah.
have, because I know like if I'm alone, I think that's a big problem with me is if I'm like alone too much,
Mhm.
like with my thoughts, like
Yeah.
that can like kind of get to you.
Yeah.
But yeah, so going into the hypnotherapy part of it, I feel like it's kind of somewhat of a well, I was just gonna have like an astrology person on, And then also with hypnotherapy, and I'm not saying that personally, like I don't believe in it or anything, because I do, but isn't it kind of like looked at as kind of I don't know what the word would be, like kind of
kind
I
of
don't want to,
alternative or
yeah.
excuse me. Yeah, so it's kind of looked at as kind of a an alternative treatment, or even they'll say like a woo woo kind of energy work, kind of thing. But it's definitely the American Medical Association and the British Medical Association recognize it as a viable treatment for all kinds of disorders. But it works really best if there's anything really deep within you. It helps you to get over that kind of hurdle, so that you can go on to utilize other treatments and other therapies that might be more traditional, where a lot of times you're in therapy for years and you just can't get past, you're either telling your story over and over again, or you're just tired of telling your story, or you can't just get past this one block or hurdle to get you to where you want to be in life, and hypnotherapy is really great for that. Um, so yeah, there's all different levels too. There's clinical hypnotherapy, which I'm not a clinical hypnotherapist. I'm a certified hypnotherapist. But with clinical hypnotherapy, they work with medical conditions. With IBS is a real big one that it works well for, different digestive problems, and it helps a lot for pain relief as well. Helps people getting over addictions, even if it's just overeating or smoking. It's real big for that, real good for that. um, it helps with anxiety and depression. But what I was talking about before with like inner child work and stuff, you can do a lot of that stuff and get to that root of, some people will come and say, I've got this problem and this problem and this problem. What should we work on first? And so we'll do a few general things and then we'll see what comes up for people. And it's all within their own head. It's nothing I'm doing for them. They have, it's all within their own subconscious mind. Whatever comes up for them is what they need to work on. So we'll see what comes up. And sometimes there's a bigger root there that is, all these little offshoots are the things that they see as symptoms and what they need to work on, when really it's something deeper.
And I've heard that it doesn't work on certain people. Is that true? Like some people just have too much of a guard up to be able to be hypnotized.
Well, I think a lot of times those are the people that go the deepest. The ones that think that they can't, they'll like either fall asleep or they get really emotional, sometimes. But there are people who are thinking too much and they're hanging on every word that you're saying because they don't want to give up sort of that control. And they're just, hanging on every word that you're saying while you're doing the session with them. And it does take the person to be able to let go, to just let go, relax, and just let the words come in without hanging on every word. I don't record my sessions, but I do let the clients know that if they want to on their end, they can record it if they want. And then they can listen back in between sessions, or if they want to know, whatever visuals they might have had, because it's very much like a dream state. So whatever visuals they might have had, they might not know what you said, and then they can go back and listen to it if they want to.
Yeah. And is it similar to like I always forget the name of it. It's not psychotherapy, but there's a certain type of therapy where like they have you lay down and like close your eyes and kind
That's
of like drift off. Or
that's what hypnotherapy is. Yeah. Yeah.
there's hypnotherapy, but isn't there another one that like it's like Sigmund Freud
Mm,
kind of did it? Do you know what I'm talking about?
no.
I'd have to look it up. Maybe it just is hypnotherapy, but
Maybe it
I feel
is.
like there's another name for it. Like where, yeah, okay, I'll try and figure out what the name of that is that I'm
Okay.
thinking of. But so
But
yeah, as far as what's up?
there's so you had asked about people who shouldn't have hypnotherapy, and we're not supposed to. We're taught in the courses, and even through the board, it's in their their laws with the board. You're not allowed to give hypnotherapy to people with schizophrenia, and so that's the only thing that I know of that you're not supposed to even try it with, is somebody with schizophrenia.
Okay. Yeah, I think I want to say the only hypnotherapist that I've really actually seen in person was actually like, I think he was a comedy hypnotherapist. Like me
Right.
and my girlfriend a while ago went to this comedy club or something in Irvine, and the guy, he had everyone come up on stage and then he hypnotized them, and then he had them like, he would have control over them, and
Yeah.
I think he had them like kind of like walking around like dogs or
Right,
something,
right,
like, you know, like where he was telling them what to do.
right.
Um, but yeah, I've never really actually been to a hypnotherapist or really even seen it done.
Yeah.
Um, would you be able to do it like on me right now, even if it's kind of like a more like low level one, or like just to
Um,
show me what you do?
I would have to get some stuff first in front of me, but I could do a little bit of one to start if you wanted to, but it's more like a guided meditation. It's where, so you would make sure that you're comfortable and relaxed, and then I would talk you down into like a relaxed state, and then we get into whatever you wanted to work on. So if I was to give you a little sample right here, I would just do like a total relaxation and then bring you back up out of it. Um, so I can do that if you want, but I want to get my paper first so I know every word. But yeah.
If yeah, I'm down to do it if you want to do it. I don't know how well it works like over Zoom. Like, do
Well,
you ever do it over Zoom or?
I do it over Zoom, and I do it over the phone mostly, actually. So it
Okay.
works perfectly fine. Usually people are like reclining or laying down, and I just have them so they can hear me without having to hold a phone or anything. It's usually not, they're usually not sitting up like this with headphones and stuff on, but whatever way you want to do it, even if you just want for your listeners to hear a little bit of it. But I do want to give a little disclaimer before we even start, to anybody that would be listening. Don't listen while you're driving or while if you're the only one that has little kids with you, not to listen during that. Make sure you either, you know, talk during it or turn it down or whatever. But if you want to give me just like a couple minutes, I don't know if you have stuff that you can say or whatever in between there, if you can edit this part out and I'll
You know
go
what,
get.
if you want, I'll just pause it and then,
Okay.
yeah, so I'll pause it and then go ahead and get the. All right, hey guys, we're back, and Pamela is going to hypnotize me. I think this is the first time that I've ever been hypnotized. So
Well, this is going to be just a very simple one. This is just going to be one to fully relax you.
yeah,
So,
that's totally fine and good.
okay. Okay. So are you ready?
Yeah, it's probably, I'm trying to think if I just like kind of like lay back in my seat as opposed to laying down would probably be better.
So just make sure you're comfortable. Yeah, everybody doesn't have to be laying down. It's just what they mostly choose to do. You can just be reclining or sitting somewhere where you're nice and comfortable. Make sure that nothing's crossed, your arms, your legs aren't crossed. You might want to have your feet firmly on the ground, your arms either at your side or on your lap or something. Okay. So
Okay.
let's just begin by making sure that you're comfortable. Uncross your arms and your legs. And if you would like, take a few slow, deep breaths. And as you do this, you may set your intention for the session, giving yourself permission to fully relax and let go. That's right. Just easily and effortlessly allowing yourself to soften quietly and comfortably, allowing your eyes to completely close down now, and just to remain naturally closed, nice and comfortable, easy and relaxed. Now just notice any thoughts that may arise. Just noticing as they come in, free from any judgments or expectations. And simply allow any thoughts to just easily and naturally move through your mind. And those thoughts will begin to slow down all on their own and your mind will become even more clear. I now invite you to take this moment for yourself. Just this moment. It is all for you because this is your time just for you. Now relaxing further down now. Just imagine a wave of relaxation as it moves through your body, all the way through, relaxing you as we go deeper down now, allowing all the muscles in the top of your head to relax as your forehead and your eyebrows begin to smooth out, calm and relaxed, and your temples and down to your jaw, nice and relaxed. And your teeth may part just a little bit as your jaw relaxes. That's right. And your neck is at ease, very relaxed. And your shoulders are free to just drop down now, releasing any weight that you may feel there. Letting go. Very calm and comfortable. Relaxed and easy. Feeling that wave of relaxation move down your arms now, all the way through to your fingertips, all feeling loose and easy, calm and comfortable. And now that wave of soothing, calming relaxation moves down your back and to your lower back, all easy and comfortable, through your torso now and down to your hips, relaxing any tension, all feeling loose and easy, feeling very comfortable and at ease. And notice as that wave of relaxation moves down your legs, through your knees, and all the way down to your ankles, all feeling loose and easy, relaxed and comfortable. That's right. Nice and easy. And your feet feel as though they are soaking in soothing water. It feels so good to just let go. And you may find that your mind and your whole body is at peace now. Now, in just a moment, we'll come back to full waking consciousness, still feeling relaxed and at peace. And when you're ready, you may begin to wiggle your toes and wiggle your fingers, and blinking your eyes as they may feel bathed in soothing, clear water. Recognizing now that you are more aware, easily and gently coming all the way back to your present waking surroundings, coming all the way back, more alert and fully awake now, feeling refreshed, renewed, and at peace now.
All right. So yeah, I definitely feel like more relaxed now.
Good, good.
Yeah. Thanks for that.
Yeah.
That free session.
I do give a free consultation, and in the consultation, I always give a complimentary just sample session. And that is one of the sample sessions that I do for people. So it's really just a relaxation. And then with a full session, it would be that. So we would relax your whole body for the people that need it. Um, and then we would go into deeper issues. So I would talk to you about, either connecting with your child self, or we would go into a thing where we open doors to look at your past and your present and into your future, or looking deep in a mirror, or untying knots that are within you, things that are blocking you. So what we did just now would be like just the beginning to get you relaxed and get your conscious mind to quiet. And then we would go into a deeper session. So that right there was what somebody would get pretty much if they, booked a consultation with me. And then, like I said, you get a free complimentary sample session. And that's to kind of show you what it's like and how it feels for you, to decide if you want to have other sessions.
Yeah. And do you normally do like an hour, or how long does it normally
I
take?
don't do an hour. I usually they are anywhere from about 15 to 30 minutes. And like I said, when I said if somebody needs it, because some people will drop right into it right away and they don't need that longer induction time. But some people have a hard time quieting their mind or relaxing their body. And so those would be longer. So I don't charge by the time, I charge by the session, because I don't think that, because somebody takes longer to fully relax, I need to charge them more for that. It's just per session.
Okay. And how much is it?
It's $100 per session. I do have a low income rate, and I also have, if you book 3 sessions and pay up front, it's a lower amount per session. So I do have a couple of deals like that going. And I do give once a month, I give a free session, kind of what you just had right now, for firefighters, teachers, and healthcare workers. So they can just get one free one a month to help prevent burnout and help with stress.
Yeah. That's cool. And so as far as like if somebody wanted to do this, how much schooling is it?
Yeah, so it's 300 hours altogether. And so for me, it was, I started in, what was it, January until June or July is what it took this last time. And then you have to go through the board certification. But it's 300 hours, 200 being in classroom, and then 100 with the public practicing for free with volunteers, basically.
Okay. And what school did you go to? Or
So I first went to Southwest Institute of Healing Arts, and that it was in Tempe, Arizona in 2010, and they still have the same program. But then in 2020, I went to the California School of Hypnotherapy, and both of them um, are recognized by the ACHE, the American Council of Hypnotist Examiners board. So there are lots of schools out there that you can get a certificate from the school, but it's not necessarily recognized by the board. So you're certified from the school, or you have a certification of recognition. Otherwise, if you go through the American Council, the board, the state board, then you're certified with them. So there's, on their website, they do have a whole list of schools that you can get board certified through.
Yeah. And is there, I've always kind of wondered, like, if, let's just say I wanted to be like, I've like studied it myself or whatever. And I'm like, I want to do hypnotherapy on somebody. I mean, I'm assuming that's like against the law, right? Like you have to be,
No,
right? Or no?
it's considered like a self-care or a self-help type of a thing. So there are plenty of people that do hypnotherapy that just read a book and said, "Hey, I want to try this on my friend," and it was really successful with their friends. So they start telling other people, and other people start coming to them, and they had really no schooling. And it's not against the law in most states. I do believe there is a couple states that do have more strict laws, but most of them you don't.
And is that also true for like regular therapy? I never really know what to call like regular. I guess it would just be psychotherapy, right?
Well, there's all different kinds of therapy. So, to be honest, I'm not sure either because there's different kinds of talk therapy, there's psychotherapy, there's, behavioral therapy, there's all kinds of different therapies. There's EMDR therapy. You have psychologists and psychologists and psychiatrists and all different kinds of, you have licensed marriage counselors and, yeah, there's all kinds of them out there. So I don't know either, honestly.
So like, I mean, if I just wanted to go to like a psychological therapist or a psychotherapist, um, do you know if they have, let's just say that one, psychotherapist, like do they have to be certified, or
Yeah,
can
yeah.
I
They
just say,
they
yeah?
mostly most of them are licensed through the state, just like a medical license would be, just like nursing would be. You have to go through, there are laws for those, for most of those. Uh, there's certain words you can't use. Like I can't use the word, I can't say that I'm a counselor. I can't say that, so I'm a hypnotherapist, so I can't really consider myself as a therapist, but I'm definitely a hypnotherapist, which is different from, so there's a hypnotist who learns different techniques and protocols for hypnotherapy, and for hypnosis for healing, but they didn't learn hypnotherapy. It's kind of a fine line there. um, and it's all legal. But then you have your stage hypnosis, which what you were talking about. And a lot of times people will come to me and say, "Oh, are you going to, make me bark like a dog, or make me do this or that, or cluck like a chicken," is the big one too, and I don't even know how to do that. It's not something I learned. But yeah, you have, for the other kinds of therapies, the ones that are licensed therapists and licensed counselors, that's where that big difference comes in. There is no license for hypnotherapy, it's only a certification. Um, so you would want to look for somebody that was board certified and not just certified through their school or a certificate of completion from the school. You want to look at, if they're certified through a board of certification for the state that they're in, or the nation even. Um, that you can look up the boards real easily online and find out what's what.
Yeah, because I actually majored in psychology, and
Mm,
I couldn't really like pull the trigger on going to get my master's or doctorate in
yeah.
it, because I was just like, at the time, and even still, but more so at the time, I also had like a mental break, and I had
Mm,
anxiety and OCD and all that stuff. So I was like, I
yeah.
just don't think I'm going to be able to like talk one on one to people who I may, be just as anxious as.
Right.
Um, but I mean,
Or
now with the
triggered
whole,
by, for that matter. Yeah.
exactly,
Sorry.
yeah, yeah, no, yeah, and then if I like did, but like with Zoom now, like what you're doing, it seems like it's a lot better. But it's like I could imagine in some situations, like you might feel like a little uncomfortable, like if you're literally there with the person, and
Right.
especially in like some serious therapy session, and they start to get real angry or something,
Yeah. Yeah, I think that most people really love being able to, they're more able to let go quicker than if they had to drive to an office and be there with somebody that maybe they don't know, or maybe they're anxious that somebody's going to see their car or see them in the waiting room. But then they come out of their therapy session and then they have to get in their car and drive home, go through traffic, all of that. To me, once you're at home, sometimes people fall asleep and they will tell me, if I fall asleep, or I will ask them, if you fall asleep, do you want me to just hang up and let you go? Or do you want me to make sure that you're awake first? And sometimes I'll say, set an alarm. If if you're somebody that I've worked with before, and I know that you fall asleep in your sessions, you know, set an alarm if you need to go anywhere afterwards. But but yeah, people can let go and relax even further if they're in their own recliner, their favorite chair, laying in their bed. They don't even have to have their camera on. They can be wearing whatever they want. They have their pets with them. It's just so much more comfortable and at ease. And there isn't really an issue of, you know, um, am I going to lose control, or I'm with this person I don't know, you know? Yeah.
Yeah, for sure. But yeah, when I first started going to a therapist a while ago, that was what was going on with me. It's like, well, first of all, I was going straight from work because they only do it till 5 or whatever. So like
Right,
I
right.
was going I was going to work from 8 to 5, then I immediately had to go see this guy like
Mhm.
right after work. So I drove over
Ugh.
there in traffic and was all stressed out. Then, like you said,
I
like worried if people see me or whatever, and not
Yeah.
like it should be embarrassing, but
Right.
some people judge.
It's one of the reasons. So as you know, I've done a few other podcast interviews, and a lot of them are more so on my journey of, because I wrote my memoir. I didn't come this far to only come this far because I did have this total mental break, and now I'm living a life that I totally love, every bit about it. And I think that it's really important to tell our stories. And so there isn't such the stigma of reaching out for help when you need it, and so that people feel that they're not alone, and that there is hope, that people do come out of these breaks. They do come out and can go on to live their life.
Yeah, exactly. And like what you're doing as far as writing the book and coming out and saying that you didn't like being a nurse. I feel like a lot of people feel like they're going to be, I don't know, I could be wrong about this, but I feel like a lot of people feel like they're going to be stigmatized if they say,
Yeah.
like, even just saying, I don't like my job, or like,
Yeah.
I'm unhappy at my job or whatever. And it's like so many people I feel that way, that nobody really comes out and says,
Yeah.
hey, this isn't a good working environment. Like,
Right.
we're supposed to be helping people here, and your own employees are, you
Right.
know, suffering themselves from just showing up to work. And something should be done about it, in my
Yeah.
opinion. And but yeah, so as far as the whole like just spiritual thing goes, I've recently kind of somewhat gotten into like consciousness and stuff like that,
Mm-hmm.
and um more kind of like spiritual stuff. I'm not really like a spiritual person, to be honest with you, but I
Mm-hmm.
find the whole thing kind of interesting. Do you have any takes on consciousness or spirituality? I don't know if you do you know who Sam Harris is by any chance?
I don't think I do. No.
He's like kind of, I'd probably, or yeah, he's like somewhat like kind of like a philosopher type, talks about
Ah.
consciousness, and he has his own meditation app. So what you were doing is very
Ah.
similar to what
Yeah,
he
it's
does.
very much like a guided meditation. Yeah. But when you get into the hypnotherapy, it gets deeper, a little deeper than that. Yeah.
Yeah.
But yeah.
And I was just wondering what your thoughts on spirituality, consciousness. Are you like religious or anything like that?
I am not religious. I don't have a religion that I follow or agree with, but I do consider myself sort of more spiritual. I do meditate daily. I do believe that there is a whole realm of spirit guides, your whole spiritual team, and it could be for some angels. I feel like whatever people want to call that realm, or call that their spirit team, or even if there's, some people will call it God, other people call that consciousness, is God, or some people will say that it's just the universal energy, and that's kind of what I call it, is universal energy. And I do believe, like fish in water, the fish doesn't know, is water surrounds them, but they don't know it's there because it's always there. That's what I feel like the universal energy is. It's all around us, and we don't see it necessarily. We can't taste it or smell it, but when you feel in that space of, you are in your element, you are in your flow, you are doing everything you love, everything's working out for you, that's when have more of, you're more in tune with your consciousness, in my opinion.
Yeah, for sure. Um, yeah, as far as I don't know, as far as the consciousness goes, like, have you heard of like idealism versus materialism or any of that kind of stuff?
Well, kind of. I mean, I kind of, yeah. I'm just gonna say that. Yeah, kind of. I don't study it. I don't know exactly. When I think of materialism, I think of, what you can only tangible see and what is under the microscope and all of that compared to, what is kind of the stuff I was describing, vibration and energy. Yeah.
Yeah, so it sounds like you may have already answered it, but would you say that you're more of like a materialist or an idealist? Um,
I would say
yeah,
I'm definitely not the kind of person that has to see something to believe it, but I also don't believe that there is any one particular higher power or anything. I don't think that there's not, God to me is not a man or even, is not even a spiritual figure. I mean, God to me is more of a word for, universal energy, for the energy that's all around us, like, like water is to a fish, Yeah, I do believe that
yeah,
we're all connected with this one sort of consciousness. I do believe that. Even things like rocks and living things like trees and just anything and everything that is in nature is part of us, and the stars and the planets and the sun and the moon and us, and every cell in your body and every cell in my body, we're all part of all of it, you know.
yeah,
That's my belief.
yeah. I think it's interesting to, it's just interesting to, realize that there's more going on than, like you said, like what we see.
Yeah.
There's more going on around us. Like I only think that everything that I see, I think that it's just it is as it is.
Hmm.
But they're kind of coming to find out, even with physics and science and stuff, that it's like a lot of this stuff is could like not even be there, or like it looks differently through our eyes than it
Right.
actually looks. You know what I mean?
Yeah, yeah.
It's a
And
whole
it's fascinating. It's fascinating. And it makes sense because there is, they say everything is a form of energy and everything is moving and vibrating. Like, even like you said, something solid, even the cups we're drinking out of, they're completely solid and they're holding our liquid. But even them are, by some belief systems, I guess, or some sort of science, tells us that these atoms or whatever it is, right, that's holding them together, there's space in between them and they're moving. And that what I'm looking at might not be the same to what you're looking at. And it to be one thing, a cup or whatever, and I know it to be, something different. And it's all, these words that we humans made up. It's fascinating. It is. It's such a huge rabbit hole. It's such a huge thing it's a philosophical question almost, such a huge
yeah,
thing to contemplate, but it is fascinating for sure.
for sure. And then, do you believe in any type of like kind of like dark arts, or if that's what they call them, dark arts, or like psychic type stuff? Like I said, I was just going to talk to an astrologer. Do you believe in any of that type of stuff, or do you like?
So I do believe that that when we're born, the way that the planets are aligned can have some influence on who we are as a person throughout our lives. I personally don't know anything about it. That is very that's a whole nother rabbit hole to go down. I mean, once you look into it a little bit, you realize there's so much that you don't know, and there's so much, like, you could spend a lifetime studying it. It's just a whole lot there. But I do believe that the way that the planets are aligned when you're born can have an influence. I do not believe that I could read my horoscope every day and it's going to give me anything that I need. I don't believe that. But I do believe in, like, having somebody's chart made by the time they were born, the time and the date and even what time zone they were in and that, to get everything right for each individual person. I believe in that kind of stuff. I've never had my chart done. I haven't had that much of an interest, but I'm born sort of on the cusp kind of. And so anytime I read a horoscope for me, it doesn't really make sense for me, or what I'm supposed to be for my sign doesn't really line up with who I am. So it's funny that even despite all that, I still believe that that is true as far as the planets and all of that, but I don't know much about it.
Yeah. Yeah. And then do you have any kind of like crazy hip hip hypnotizing stories that you're able to, I don't even know if you're able to tell any, but
Um, let's see. So I did have, so somebody, and this is even when I was a student. So I was a student and I was giving free sessions, just a little bit more than what I gave you, a little bit deeper than what I gave you. I kind of just did you a relaxation and that's it. But this person said that they saw all their dead relatives came in to their consciousness, all their dead relatives came in and said goodbye. And it was just like it was even shorter than what we did. I think it was just a really short little thing, but it was deep. And so they had all their dead relatives come in and say goodbye during that time. And that was pretty fascinating, I thought. I also had somebody and it was a man, he was an older gentleman. And I think he was just doing this for me because I was calling for volunteers, and he like kind of he just relaxed and he didn't say anything. And then after that he said he said something like that was really deep, and that he went places that he didn't want to go, and he didn't want to talk about it. Like, and I never heard from him again. So I don't know what happened there. So I've had a couple people actually. So people will come to me to quit smoking, and I will ask them, do you want to quit tobacco, or are you talking about, other things as well? Because as you know, in California and a lot of other places, marijuana is legal. And I have people that want to quit smoking cigarettes, but they still want to be able to smoke marijuana occasionally or whatever. I don't know how much, but so we get into these situations sometimes where they want to quit smoking, but they don't want to quit smoking marijuana. So I've had to get to, people will come back to me and say, that it didn't work because of this. And then I have to find out. So I've had to switch things up when I'm helping people to quit smoking, because we have to get clear on what you want to continue to smoke and what you can have a line there. And if you don't tell me, then I don't know. And then you're going to be, either continuing to smoke cigarettes, or you're going to quit everything, and it's not what you
I
wanted.
don't want to smoke cigarettes, but I want to keep smoking marijuana or whatever. Yeah.
So
Yeah.
I've changed, because I have to be clear on what they really want.
So how does that work? How do you get somebody to quit smoking? Like, do you just somehow like get inside their mind and be like you just don't want this anymore type thing? Or?
Well, what we do is we take them to a place of before they started smoking, and to find out at what point are you finding that you need to pick up a cigarette? Is it habit or is it stress? And when did this start and how did it start? And are we dealing with an addiction or are we dealing with anxiety? So some of those are the longest ones, meaning, you need more sessions, because sometimes it goes back to childhood, and sometimes it's really deep, and sometimes it's just surface level habit. So I will say things within the session, just imagining your lungs clear and clean, and with every fresh breath you take, you're cleansing your whole body, and you find that you no longer, crave for a cigarette, or I don't know, stuff like that. But we just bring you into that headspace, and then we give you these positive, suggestions.
And it usually works.
Yeah, but it takes a while. Usually the cigarette smoking ones are the ones, because it is an addiction, that's so, yeah. And speaking of addiction, there was somebody else that they were in recovery, and So I did a couple sessions with them, and they said, I've done a lot of acid in my life, but I've never been on a trip like that. So I thought that was pretty funny one too.
Yeah. Yeah, if you can get to a place, a crazy place like an acid trip, but you can do it like without taking anything, that's pretty good, right?
Yeah.
But yeah, so is there any truth to like the clock thing, like with the clock going back and forth or that
You
type of
know,
thing?
there is a kind of meditation, a kind of guided meditation to where it's a focused guided meditation. And so hypnotherapy kind of could work in that way without closing your eyes. And just like EMDR therapy, do you know about EMDR therapy? So it's
No.
eye movement desensitization and reprocessing. But you move your eyes back and forth like that, but with your eyes closed. So you move like it's like REM sleep, you're moving your eyes back and forth, and it does something inside your brain to make it so that you can process things. So it's the same kind of thing. So that when they started out, and there are some hypnotists, not necessarily hypnotherapists, but that still use that, any kind of pendulum, but they, back in the day, all the men had their pocket watches, right? So they use their watch. And so that's kind of the symbol that we think of now. But any kind of pendulum, anything on a string, they could use, and have somebody go back and forth while they say things to them, kind of relaxing them. Rather than closing your eyes, you're watching this thing go back and forth. And there's something with the brain that's how EMDR works. There's something with the brain that happens when you're moving your eyes back and forth that works in the same way as the REM sleep.
Yeah, that's interesting. It's almost kind of like a life hack or like a brain hack, to like
Yeah,
get
yeah.
yourself to like snap out of it or snap into
Yeah,
it.
yeah. If you're feeling highly anxious, like say you're at a store or in a public place, you don't want to look crazy, but you can close your eyes and just move your eyes from one side to the other for a little bit, and you'll find yourself calming down. Your racing thoughts, will slow down if you just do that. And even if you're driving, a lot of times, if you're driving and you're just getting really highly anxious, you want to pull over, of course, but then you can do that too.
Yeah. And then in terms of getting clients, how do you go about doing that?
Well, I have a website. I'm also all over social media with my business account. So really that I also have a couple ads in just like these, these resources, these lists of resources for different therapies and stuff. I have my ad on some of those. Um, so really just, that social media, my website, the lists of resources. Yeah.
Okay. And then I'm like a poker player, and I haven't actually played in a while now, but I was really kind of interested in like the psychological aspect of it in terms of,
Mm.
because so much of the game is trying to figure out what your opponent has, and
Yeah,
somewhat of like manipulation, psychological manipulation, stuff like
sure,
that, which
sure.
which you can use with, I'm sure you don't, but some people could probably use hypnotherapy for. But do you not so much believe, but are there any, I guess, tips or tricks when you're playing? I guess poker would be like one of the only situations where you should do it like ethically or whatever, but to kind of like maybe get like a read on your opponent, or just to
I,
try and be able to figure out what somebody's thinking, kind of thing.
I think that goes more in line with behavioral, like looking at people's behavior and their body language types of things. I don't know that hypnotherapy could really help in that. But what hypnotherapy could help with is imagining yourself winning, imagining yourself throwing down the most amazing cards, imagining yourself getting all the chips before you even go to the game. And not only just picturing it in your mind, but getting that feeling like, yes, oh my gosh, I won, just that feeling that you would get. When this is really good for people that have test anxiety, we will bring them to the space of taking the test. And even though they don't write on tests anymore, a lot of times it's online, but just imagine a big A across that paper, or just knowing every answer, just, how you feel when you're taking any kind of a test and you're like, oh yeah, this is easy. I know this one. Oh yeah, this one, there's just no doubt, that you know them. So get that feeling within you before you even go. And even athletes will use hypnotherapy a lot of times to envision making that goal, making that basket, seeing the numbers on the points go up, and just, or seeing themselves cross that line. And they're more likely to do that if they have imagined themselves doing that beforehand.
So yeah, you feel like that really works.
Oh yeah.
Just imagining you winning will, because it probably just puts you like in like a better mental
Yeah.
state, headspace, right?
Absolutely.
Yeah.
Absolutely. And I would suggest, even doing this, you know, a couple days before, do it a few times, not like just before you go. And then that's the only time you do it. It's kind of, you keep doing it and you can imagine it more and more vivid to where you get the feeling and you just know you're going to win. You just know you're going to, because you've had that feeling, say every night of the week for, for the week leading up to whatever game or whatever thing you're doing.
Yeah, for sure. And you should really probably just be doing that for everything, kind of, right? Like going
That
to
would be
work and anything you're
right.
doing. Like
Yeah,
you should
that's
probably just
kind
have
of
really like a positive attitude.
right. I was just gonna say, that's what having a positive attitude is all about, is just being positive and thinking, instead of, what's the worst that can happen, you want to think, what's the best possible outcome of this? What's the best scenario that I could walk into right now? You know, um, Probably if I did that in my nursing career, I probably would have had a better experience. You know, what's the best possible situation that I could walk into right now? And just imagine that, or imagine getting there and being relieved that, oh my goodness, we have all the nurses we need. Oh my goodness, I've got all the supplies. Or that patient that needed to be in the hospital was admitted in the hospital. And so just, if you imagine all these great things, it's more likely to be. And I thoroughly believe that. You can imagine when people always think that the worst is going to happen. Of course, that's more likely to happen then. They're just putting that negative energy and
Yeah.
vibration out into the world.
Yeah, it's hard to for some reason it's hard to have that. I mean, there are times where I'll naturally, especially with work and stuff, I'll
Hmm.
naturally kind of be in a positive mental state. And there's times where I'll be in a negative state, and it's very
Sure.
hard to kind of control that. And a lot of it, I think, has to do maybe with like sleep, like just getting
Oh
enough
yeah.
sleep and waking up with energy and not being tired.
Oh, absolutely. Yeah. And that's another thing, that hypnotherapy, not to sound like a big hypnotherapy commercial, but that's another thing that it can help with, is with insomnia. And people often find that once they get their sleep in order, everything else kind of falls into place. They think that they're not sleeping because they're so anxious, or because they can't relax, or whatever it is. Maybe it's the other way around. Maybe you're having all these other symptoms because you're not sleeping.
Yeah, and sleeping in general is kind of like a complicated thing. But sometimes I'll like sleep too long and feel bad. Sometimes I'll sleep. It's just it's like it's hard getting that like perfect amount of
Right. And the thing is
sleep.
you don't feel like you have control over it either. So it's like people can easily say, "Well, get more sleep." And you're like, "Okay, I will if I could," right?
Yeah,
But you don't always feel like you have that control. Yeah.
yeah, exactly. You kind of have to force yourself to go to sleep at a certain time, and then force yourself to wake up
Right.
at a certain time.
Right. There's a
Yeah.
whole like protocol and whole routine thing that definitely helps. Yeah.
Yeah. So in terms of your book, well, also just work as a nurse too, would you say that most of the other nurses you worked with were also kind of unhappy with the situation they were in?
I would say it's about half and half. And what you were talking about before, I think that because I have my memoir out, that's been published for a year, but I'm writing the book about nursing right now. I'm in the middle of writing it now. It has not been released yet or published yet. But I do think that I'm going to get some negative feedback from other nurses, even ones that I know, because so many, like you said, so many of them, that's their life. Like they always wanted to be a nurse and it's in their blood and they can't imagine not being a nurse, and it's just such a noble job and they love it. And and it's almost like a secret, like what you were saying before. So I think that there's going to be a lot of negative feedback from that, um, but there's going to also be others that say, I'm glad you talked about this. This needed to come out. It is kind of like a secret. And yeah, it's going to be about half and half from nurses that I've worked with and people that I know in the healthcare field. Many of them are very much, it's, they can't imagine life without being a nurse. And the others are going to be like, I totally get it. I wish I could get out of it. Or they did leave, they couldn't do it either. So yeah, about half and half.
Yeah, it's kind of an interesting, you know, like mix of people. But it's like same thing with like my job. Like there's some people in there who just seem to love it, and there's some people who seem to hate it.
Yeah.
And yeah, I don't know. I don't know if there's people who love it, or I don't know what's going on. Like I don't know if they're just kind of like warriors, evolutionary warriors, kind of like they've just been trained to be like workaholics or something. But
Yeah.
good for them. Like if they love it, then that's obviously a good thing.
Yeah.
But there are the people who don't like it, and I think those people shouldn't go unnoticed. So yeah, as far as your book goes, where can people find the book, and then how is it done so far, and all that kind of stuff?
So the book has been out for a year, and I've gotten 12 positive reviews, and I've gotten one that was just like 1 star, and they didn't even give any kind of feedback as to why. And so it's on Amazon. And if you put my name, Pamela Topjian, Topjian, in the Amazon search, you'll find it. And that is, I didn't come this far to only come this far. And it's really about childhood trauma leading up to trauma in my adulthood. It goes through my marriages, it goes through some of my work, and then it goes through the breakdown, and then coming back up from that, and up to where I quit nursing and started hypnotherapy. And so then so that's on Amazon, and it's done well. I've sold 30 copies, and I don't know, that might sound like nothing, or it might sound pretty good, but to me, I'm happy with that. I didn't do it
Yeah.
for the money. I did it to, so the people who needed to find it would find it as sort of an inspiration that you can come out of a breakdown, that you can live a life of trauma and come out to end up loving your life, even, it's not too late, even in your 50s, to show people that they're not alone. And yeah, so they can find me though, at hypnobreakthrough.com is my hypnotherapy website. There's also a link to the book on there as well. And on Instagram, Facebook at Hypno Breakthrough. But yeah, so I've gotten mostly some positive feedback from the book. I've had some people say that after they read it, they had to take some time. So I do want to give a trigger warning, because it does talk pretty graphically about, sexual abuse, assault, and, suicidal thoughts and stuff. So there's some pretty graphic stuff in there. But it gets better. It's a hard read in the beginning, but it gets better, obviously. So
Yeah, and is the goal to kind of like eventually be a writer, or would you still be doing both?
My life's dream is hypnotherapy. I love it so much. I get as much out of it as I give. And but I do believe that I'll probably always be writing too, because I only wrote the book because I started writing sort of as a therapy for me, not knowing that I was going to publish or not. And I kind of wanted it all down as a record in case the suicidal thoughts won. I kind of wanted to have that written down so that everybody knew, like my friends and family knew what led up to that. And then after I had read some memoirs, and after I started getting out of that and doing so much better, realizing the childhood trauma stuff led into my adult life, and not realizing that until I was in my 50s. I wanted to show people, I thought this would be a good thing to get out there to show people that it can get better, whatever they've been through. And no matter how old you are, when you find out, when you realize that, that you need some therapy, to go ahead and get it. Um, you know, so, uh, so I don't remember what you asked me, but yeah.
I think it was the oh yeah, if you would just be a writer full time,
Oh
but
yeah, yeah. So
you like both, right? So
yeah, so then I started writing the nursing because I kept getting other questions about the nursing bit in the book, and and also because I'm a former nurse and now hypnotherapist, I get questions about that. So I thought, you know what, I'm going to see if I can write a little book on the nursing career, because there's a lot there, and it does feel kind of like a little industry kind of secret, that should be told for sure.
yeah,
So yeah, so I really
you
find that I like writing and getting that stuff out.
yeah. Yeah, you really just wonder how many people are like miserable in their
Hmm.
jobs and just yeah, I don't know.
They feel
Um,
stuck.
they feel stuck and yeah, and
Hmm.
it's like, I don't know. It's just like I blame, the jobs for I mean, obviously there's some people who are just gonna be miserable in anything that they do, but
Right.
if it sounds like the conditions weren't good where you were working, and it's like, in my opinion, they need to get that stuff straightened out.
Yeah.
But yeah, so oh yeah, so I was also talking with my girlfriend the other day about how I just also kind of like you feel happier now. And I think a lot of it
Hmm.
has to do with because I was in a dark place probably about 10, 15 years ago. And it's just like I think I was early 20s or whatever, mid 20s. And I think that whole feeling of like, what the hell am I going to do? Which I still don't
Hmm.
feel like I figured that out.
Yeah.
But it's like I've kind of just gotten to a place now where it's like so many people tell you like you need to work, you need to work, you need to make money, you need to find a good career. And you do. You have to be able to live, you
Hmm.
have to be able to support yourself. But more recently, especially with this podcast is somewhat recent, but I really enjoy doing it. I also really enjoy photography and videography. And
Yeah.
I mean, it's like if I'd rather make money or go out into nature and film, I'm going to choose nature because
Nice. Yeah.
it's just way
It
better.
feeds your soul.
It
Yeah.
feeds your soul. I feel way better when I'm done.
Yeah.
And don't get me wrong, I still have a full-time job or whatever, and I still, work. But it's I don't think you can like let your work control your life. You can't let your work and make you miserable just
Yeah.
so you can make more money. You have to find things that you enjoy doing.
Exactly.
And just like, it's like have a good work-life balance. It's not all about one or the other. But yeah.
Exactly. It's that balance for sure.
Yeah.
Yeah.
So in terms of um podcasts, you don't have your own podcast, right? But you've been
I
on others.
Right. I don't have my own and I'm not going to, but but I have been a guest on a few, yeah.
Why do you think that you don't want to? Is it
Because
because
I
I was just
know.
thinking that might be a good thing to do to like actually do like hypnotherapy on podcasts. I don't know if you'd be able to do that or not, but
I think it's unethical because you would have to be calling it more of just, talking about like guided meditation type thing or
yeah,
visualization rather than hypnotherapy.
yeah,
Because you don't know who's listening, and you don't want somebody to be driving or, or something, or somebody with small kids, in their care or cooking or whatever. Um, but I don't want to because I see all the work that it takes. I know the behind the scenes work that it takes for a lot of people. There are a lot of people that do just live shows and then they just put them out there, and it's not as much as people who do a lot of editing and stuff. And people who have it in every platform, including like YouTube and everything. So I know that there's a lot of work, and goes mostly unrewarded other than for your own personal self. There's no, it takes a very lot for somebody to get successful and to get paid for it, actually. So with all the work that goes into it, I think the only part that would be fun for me would be the actual talking to somebody like I do
yeah,
with as a guest. Everything else I would hate. And I also do pet sitting on the time, which also feeds my soul. I love it so much. So I already have a whole lot of things that I'm doing that I love in my life. And there's always people that are looking for to get guests on. So I did put that out on Reddit because I found that subreddit and I thought, how cool is this? Just put my name out there and see if anybody bites, and a few people did actually. So that was pretty cool. But normally I don't ask people, I wait for them to ask me. So like I'll just like on Twitter or even on Facebook, or now it's kind of through people who have watched me and other things will reach out and ask. So that's fun.
Yeah. And so what are some of the other ones that you were on, and were those ones like pretty good podcasts? Like,
So the last one that I was on was called the Life Shift podcast. And that's found everywhere on all the podcast platforms, including YouTube. It was also recorded with one that was not released yet, but it's coming soon. It's Empowered Fatherless Daughters, because I grew up without my father. And another one that I was on was Recovery Revolution Live. And I was on Recovery Soul Food, which is a friend of mine. That was probably one of the first few that I was on. And so let me think. Oh, and there is Nowhere to Go But Up, I was on. So none of them that I was on are any real big ones, just kind of, out there.
yeah, yeah. I'm always just wondering like who else is, asking on
Oh,
there, and
yeah.
how are how are the other ones doing?
So
But
none of those are from Reddit.
oh, okay.
That post, I had just found that subreddit, and that's the first post I had put out there. So the others that I have, you're the first one that I have from there. I have another one that reached out that I'm actually going to do with them tomorrow. And then I have another one that reached out that didn't respond back to me when I responded to them. So I don't know.
Yeah, a lot of that type of stuff happens where
Yeah.
like they respond and then you respond, they don't respond.
They don't respond back, right?
Yeah, yeah. I think it just, I don't know what it is. I don't know, but if it's like Reddit's messaging is just weird or what. But
Yeah.
yeah. So lastly, I always ask, what podcasts are you into? It could be anything, or it could be hypnotherapy. Also, movies, TV shows, music, whatever you want, really. Books that you're into.
So I love other people's memoirs. So I like the podcasts that are just people talking about their stories in life. And usually, like the ones like that are inspirational stories. I like to hear people, who have been through so much and have come out of that to do great things in life, or even just to love their life, whether they're doing great things or not. So I love to hear people making it in the world, making it within their life and turning their lives around. A lot of recovery stories I like to hear. So there's a lot of podcasts about that. I also, like many other middle-aged women, I love the true crime stuff, and so there's a couple YouTube channels with that I like, which is That Chapter, it's called. And then there's Christina Randall, I think that's her name. Those are just YouTube channels. But I also really like this therapy stuff, like ones with different therapists that are talking about their therapy practice. There's a couple of YouTube channels like that. I don't really watch shows other than like YouTube and stuff. I don't have Netflix. I don't watch TV or stuff like that. So
Yeah. So yeah, in terms of the true crime,
yeah,
which true crime one podcast are you into?
it's called That Chapter is the one I
Oh,
watch
okay.
every single one of. And then there's the behavioral panel, and they do a lot of body language stuff along with the true crime, the people in the, in court or even in the interrogation room and stuff.
Yeah.
Yeah. And there's also the interview room, I think, is another one that's a true crime one. And Christina Randall that I mentioned, she's true crime mostly.
Yeah. Okay. Yeah, I wasn't sure if those were true crime or
Yeah,
something else,
yeah.
but yeah.
I was just
So yeah,
thinking in my head while I'm talking to you, what are they called? Yeah.
yeah. I got really into like my girlfriend got me really into true crime. Probably when I first got into podcasts because I'm a delivery driver, so I listened to a lot.
Mm,
And this was like probably like 3 or 4 years ago. I had like 5 or 10 that I was really into,
mm.
but recently I just haven't been able to find any. Like I
Oh,
listen to like Serial. I don't know if you ever listen to or listen to Serial, the podcast. That's like the biggest true crime
no,
one. Or there's
no.
like Criminal, and there's like
The thing
um
is, I'm somebody that likes to, and it might be because of my age, but I like to watch the ones that are on YouTube more so than I like to listen, like on Spotify or Apple Podcasts. I like to sit and
yeah
watch people talking rather than just listening while I'm doing other things. So a
yeah
lot of those I don't know as much about unless I've been on them. There's one that's really great. It's called Better Call Daddy, and she's on all the platforms, and she's a little bit of a bigger one. I haven't been on that one, but I like to listen to that one.
okay
But she has,
yes.
yeah, she has like celebrities and stuff on as well as just regular people.
Better Call Daddy.
Yeah,
I know there's one called I'm forgetting the name of it. It's something Daddy.
there's
Um
probably a lot of them called something Daddy.
yeah. I think she's really big, and like I think she's like, paid by Spotify or whatever. Or
Mm.
I think it's just Call Me Daddy. I
Mhm.
forgot. But anyways, yeah, I listen to a lot. I don't have the attention span to like watch the
Yeah,
YouTube videos, especially if they're long, but I'll
yeah,
listen to them in the car, and it's the perfect thing to do while driving, in my opinion.
yeah,
But anyways, yeah, it was great having you on, Pamela. And if you ever want to
yeah.
come back on again, let me know. And I hope your book and everything else goes good.
Well, thank you so much. It was a great opportunity. It was great to meet you, and I really appreciate it.
Yeah, no problem. Thank you.
Thanks.
Bye.
Bye bye.